featured speaker was named Best Cosmetic Dentist and Best Family Dentist by Living Magazine in 2017. She's a member of the Academy of General Dentistry, American Dental Association, American Sleep and Breathing Academy, and Academy of Dental Sleep Medicine. Please welcome Dr. Suzanne Tai.
What an honor to be here today at Harvard. I feel truly blessed in my life, and this is one indication of that. And the fact that I can even come here today is another indication. It's because I have such a great team taking care of my office back home. I've really been lucky with the people that I've been able to attract into my team. My office manager, hygienists, dental assistants have all been so supportive and have become such great friends of mine, which is why I was so moved recently when my dental assistant, Camilla, came into my office and told me that her father had had a heart attack and that the cause was obstructive sleep apnea. And then amazingly, my other assistant came into my office and told me that her cousin died from what I call the silent killer, sleep apnea. But get this, her cousin was only 21 years old. I know the pain of losing someone before their time. A few years ago, I gave birth to my daughter, Lily. I was 6 months pregnant with her at the time, and I will never forget this day. I went in for my normal checkup and so excited to see my baby once again on that sonogram, but then my doctor came into the room and said he found something suspicious. He rushed me to the hospital. I had to have an emergency C-section, but I was still so hopeful. When I woke up from anesthesia, I couldn't wait to meet my baby. But then my doctor looked at me and he said, "I'm sorry. I'm so sorry. But I couldn't save your baby." They let me hold her anyway. They let my son hold her. He was only 4 years old at the time. But it was to say goodbye. As we all stood there crying in the room, that was the first time that I felt the pain of losing someone. Now, dentists normally do not deal with death. We don't normally lose patients. Yeah, it is known as one of the cleanest of the health professions because we don't lose patients. There might be some blood and some spit, but we don't lose patients. At the same time, we don't usually have the opportunity to save a patient's life. And I think that's why I'm so attracted and so fascinated by sleep apnea, because this is an area of dentistry where I can really make a difference. For those of you who are not familiar, sleep apnea is where you're literally gasping, choking, and suffocating in your sleep. You stop breathing. Sometimes for just 10 seconds, but I have patients who've used an in-home sleep test that I give to them where their readings are read by a board-certified sleep physician that show that they have stopped breathing 40 times per hour. Imagine that. Having sleep apnea can lead to complications such as high blood pressure, diabetes, heart attacks, and strokes. Terrible complications that can result from the silent killer, sleep apnea. So I have a question to ask all of you. How many of you snore? Does your spouse or partner snore? Your brother or sister? Snoring is the canary in the coal mine of sleep apnea, and if you snore, it could be a good indication that you are suffering from this debilitating disease. Other indications. Do you have morning headaches? Do you feel tired and sleepy during the day? Do you grind your teeth? If you've said yes to any of these questions, then you could be at risk. The good news and the bad news. There's the gold standard treatment of sleep apnea, which is a CPAP machine, which gives you continuous airflow. It makes you look a little like Darth Vader. But for some patients, that is what is required and they can do it. Then there are other patients who refuse to wear it or can't tolerate it every single night. And if you think about it, it only takes one night to die from sleep apnea. Did you know that recently in the news, the coroner's report said that Carrie Fisher, our beloved Princess Leia from Star Wars, died from sleep apnea? And so therefore, I am so excited when I get to help my patients with this little dental device. It is perfect for the CPAP intolerant patient. There's definitely technique involved. You have to position the device in a way where it will give the maximum impact for the patient. And at my office, we have state-of-the-art technology that can help us do that and create a custom device for you. Again, I am so honored to be here today to share this message at Harvard because I truly believe that with sleep apnea and this dental device, I get to do what most dentists never get to do. I get to save lives.
Dr. Suzanne Todd.